Hey everybody, Jaron's blowing up on his end already. The guy is just busy all the time. Kevin and Jaron here to talk to you about everything in the Pharmacy Rebrand Show. So today, Jaron and I are going over kind of the healthcare of tomorrow and focusing on what we could do today about it. Jaron has a few things to be able to bring up, and I have a nice conversation to bring in that I had with ASCP CEO Chad to bring into the conversation related to some cool things they're doing. Super excited to be able to have you guys here. Any questions? Make sure you ask them. Right after the reel, we'll jump right into it. Jaron, how are you, buddy? It's good to see your face, man.
Hey, it's better to see yours though. Much prettier than mine. So.
Sweet talk. I
like it. I'm doing very good. It's been a crazy week, but I'm coming together. I finally hired a full-timer, and she's been amazing. And it's been so nice to actually have somebody help me with all this stuff I got going on. So, but what about you?
Yeah, no, I think the full-timer is super inspiring, Jaron, to be able to bring that on board. So with me, same, really busy in the consulting space of just kind of bringing healthcare data together and finding ways for technology to weave in pharmacists as much as possible, but love it. It's just a real kind of inspiration and kind of ties into what you and I are talking about of just you bringing on more healthcare entrepreneurs to be able to help you in non-typical spaces, and me trying to do more with bringing pharmacy along the ride inside of this new health tech wave. So what kind of things, Jaron, did you want to talk about today when it comes to healthcare of tomorrow? Because the landscape is changing pretty rapidly, and we're noticing some pretty big gaps that I'll tell the audience about. One, we're seeing a huge gap between number of beds available in long-term care settings, number of primary care providers, and number of patients needing primary care, especially in the geriatric world. That's true not only in the conversation that I had today with some of the leaders inside of ASCP, but also with Canadian pharmacy leaders, seeing the exact same things in their countries, and really looking at how does pharmacy play a role in that, kind of moving forward. But anyway,
yeah,
Jaron,
absolutely. It's funny. You mentioned, technology, and I think that's going to be a big aspect. And I'm glad you brought up the long-term care beds thing, because, that's where I'm at. That's where my emphasis is. And I try not to make that show through too much. I try to be a little more broad in this show, but it probably doesn't work. So yeah, there's a lot of needs in healthcare coming up here. And so, just I tested out ChatGPT today on this very topic. I just asked it what are the future needs of healthcare? And it gave me a bunch of items. And then I asked it, how can a pharmacist help improve the future of healthcare? And it gave 10 items. Now, ironically, funny thing is that the first thing it mentioned is medication management and adherence, how to take them, medication errors, reducing errors, improving health outcomes. So just, when I read it, I'll go through all of them here in a minute, but I just wanted to mention that I know our good friend DeLon Canterbury would have been very disappointed with ChatGPT's response, because it didn't say anything about deprescribing. And I was also very disappointed by that. So I let ChatGPT know this.
Oh, good.
And I said, I think you should add deprescribing or eliminating unnecessary medications to your line items where pharmacists can help. And it said, absolutely, deprescribing is a crucial aspect of medication management, even though it didn't list deprescribing under that bullet point.
Yeah, I love that. And I think the management aspect is really what, I've talked with DeLon about, I've talked to Donna Bartlett about, is really it's optimization of regimens. Lauren and I and Marina talked this morning about that exact same thing, how there's almost a conflict, Jaron, of
right.
The future of medicine is eliminating these regimens, not dispensing more. The adherence element isn't just how do we get more pills out on time? It's how do we get the right medications out? Right?
Exactly. And tailor it to an individual as opposed to just cranking out as many meds as we can.
Yep.
And I think education is a big part of that. One of the big issues that I run into when I'm in nursing homes, getting rid of unnecessary meds, is I'll put in all this work and identify, hey, we don't need this. And then a couple of weeks later, the patient will complain and it just gets restarted. One of the issues with pharmacy consultants in nursing facilities is that we're only there once a month, and we just turn in a report.
Yep.
So our perspective and our education and our expertise is lost in translation. The nursing facility or the nursing staff just walks up to the patient and says, "Hey, our pharmacist thinks we should get rid of this." And they immediately put up their guards like, "Why are we getting rid of that?" And so they are not able to educate them to understand why we don't need these meds. And I think by diversifying what we do as consultant pharmacists and expanding the reach of what we do through more services, CCMs, BHI, that will allow us to reach more patients, educate more patients, and have more impact on de-prescribing, as well as improving adherence, which, nursing homes, it's not a big deal with adherence because we have nurses administering it all day, every day.
Sure.
But, I think, and the fact that we still operate in silos throughout all of healthcare, integration with IT and different databases will be a very crucial aspect. And I know that's something you're probably very interested in. I'm curious to see what your thoughts on pharmacists impacting, analytics and integration to break down these silos.
Yeah, we talked a little bit about the long-term care component of like number of beds and individuals that are needing them. And the exact same conversation translates quite well into just general primary care availability and also into hospital beds, Jaron. We're seeing a bigger push for hospital at home and how that's going to work. And when it comes to utilizing analytics in all of these spaces, we're taking already an existing workforce that's being stretched fairly thin and being able to ask to do more with less, way too often. And so being able to bring those data points so they're actionable to the care provider so they can actually do something with them, I think is part of that equation. But the other element that you touched on right there with that case example of having you go in, analyze a regimen, put a ton of work in, make sure that everything is going toward an optimized plan, not just a drop in the bucket, we're going to pull these things out and then we're going to leave you for, hung on the dryer. It's really looking at what's the staging, what's the relationship that can be cultivated by using analytics and educating patients and caregivers alike. And so to me, it's really not validating, we think way too often as pharmacists going, well, how do I validate my decisions? Well, oftentimes we think validating my decisions is going to a journal club and then finding a randomized controlled trial to be able to say, this is how it works. Or I'm going to grab an algorithm and say, here's the algorithm where it fits in. Where we really need to be able to grab some of the anecdotal information and the personalized information, Jaron, that you and I care about so deeply, is not only delivering it to the provider, right, for them to go, okay, great, like that's nice, Mr. Pharmacist, I'm going to take your advice and go with it, or I'm just going to shove it off anyway. It's going to the level of impact on individual patients and what the results have been in experience. And I think there's some real analytical information, real world analytical information, not clinical laboratory information, that we have to make more readily available based on the amount of patients that we're seeing. Jaron, you're seeing thousands of long-term care folks, and so with seeing all those individuals, you're able to collect a massive data pool. And I think it is a terrible waste if we think the healthcare of tomorrow isn't going to leverage those insights of saying, Jaron has worked with these many individuals with this physiological demographic makeup. He has made these changes, and this has been the result of those changes. That's beautiful because that speaks to the physician on, makes sense. There's actual data that backs us up. Speaks to the individual patient to go, oh, wow, so this really worked for them, the plan that he's laying out for me. It's just like you and I going on to Amazon and going, what were the reviews? How many stars did they give? What was the response to this? And we have that same level of validation we can apply inside of healthcare. And I think that's my mindset. Your thoughts, buddy?
Yeah. I think there's just, a lot of people don't think that pharmacists can make a huge impact in the informatics area. And I would disagree. I think there's a lot of medication management that will go into these things, and our expertise can be implemented in there. And, once again, currently, a lot of informatics is going to provide us with data that is, may or may not be useful. And so utilizing a pharmacist to assess and analyze and implement solutions based on the information provided from a lot of these informatics systems is going to be crucial. And that's going to help us maintain our position in healthcare as valued professionals that can assess this data rather than just regurgitating it like all the other systems that are out there. The ability to analyze and interpret it is going to make a very crucial difference in the pharmacists that kind of are going to survive into the next era of healthcare, is what I think.
Well said.
And, also with informatics, I think an interesting aspect of that, and this, kind of plays into the silo realm as well, but with pharmacogenetics, I know I've heard Jamie Wilkie talk about this, but wouldn't it be great if you walk into a pharmacy and just hand them a list of your conditions and your genetic profile and let the pharmacist take over from there and kind of tailor your medication to what would work best for you and your conditions and your genetic profile. And, I would like to see a point where a genetic profile replaces what we currently use as like an allergy list, because technically a genetic profile can tell us what your allergies would or should be, and that should be able to replace it. Now, I wouldn't replace the stuff like this one gave me a tummy ache or something, and maybe in some ways it would, but having that available that crosses platforms from pharmacy to primary care to hospital would also not only help pharmacists, but also break down a lot of these silos and barriers so they can understand why we're making decisions, have legitimate algorithms like you were talking about, but they would be based on actual verifiable individual data, not just strictly a meta-analysis that we're generalizing for every individual patient.
I think there's a ton of powerful things to pull from that, Jaron, including just the availability of data. What we're seeing today has to change for tomorrow. We can't have pharmacists. We were talking Jenna Quinn the other day about her big push for getting weights, heights and weights for pediatric patients. I mean, for me, I want everything. I don't just want to stop at height and weight. Like I want all the laboratory values, all the clinical notes. Like we have to have this information to successfully analyze a patient and give them the outputs that they truly need. It's just like having a pharmacogenetic profile. It gives us information that can be leveraged and utilized in a comprehensive review that should be done by a pharmacist. And so I think that that's the big push that, you and I are making, that folks like Jenna and Jamie are making as well, is we need more data to be at the fingertips of the pharmacist making these clinical decisions, and also the monitoring elements that have to go and play with them. Just because we think this is going to be the best plan, the best way to make God laugh is to tell him about your plans, right? So to avoid some of that is we have to monitor successfully and know how to monitor our individual patients. And that brings up another subject of the healthcare of tomorrow. I think remote monitoring is going to be a massive next step for our profession. Being able to take in those data inputs, utilize some of the analytics, and then be able to educate and shift or alter a regimen based on those data inputs or signals that we're getting. Thoughts on that, Jaron?
Yeah, I think preventive healthcare is going to be a big aspect of the future of healthcare as well, because the goal is to reduce adverse outcomes with healthcare. And if we are being proactive and identifying concerns before they cause a hospitalization, that's going to be the goal of healthcare moving forward, as well as, just you can add to that chronic disease management. And that's part of it, is monitoring these vitals closely so that we don't run into problems and we're able to identify concerns and nip them proactively.
Yep.
And so chronic disease management is something that we've proven time and time again that we can be a very valuable commodity with. And we just have to be more proactive to make that type of thing happen. And those opportunities to do that are out there. We just not only do we have to be proactive to identify health concerns as a pharmacist, but we also have to be proactive to start implementing more of these systems and collaborating with physicians. And that's three very big aspects of what ChatGPT said was chronic disease management, as well as where did it go? The preventive healthcare and collaborative care. So I think those are aspects that we've always been proven valuable. And we got to start being proactive to start collaborating with more healthcare professionals to be an integral and valued part of the entire continuum of healthcare, not just somebody who hands you your pills. And I have a strong tendency to divorce myself from any products, just because I think it's very important that we have more pharmacists that are not tied to products.
Mhm.
But that's still a crucial aspect, and how we provide these products can also be a very valuable aspect that I would not have considered or thought of when starting to think of the future of healthcare, because my mind immediately goes to how can we be better served in healthcare, and how can we provide better services and provide better patient care. But like you said, RPMs are going to be a crucial aspect of that.
Sure.
And the more we involve ourselves in that specific product, in addition to making sure people receive their medications, if we offer these products that are proactively identifying and catching healthcare concerns, we can hit both sides of the continuum and make sure that we're getting better outcomes and helping in the healthcare continuum.
100%. And I think the beauty is we don't have to be married to the pharma products, right?
Right.
I mean,
Yeah, exactly.
We can use herbal products. We can look at nutrient depletion that happens for individual drugs and be able to recommend things to make sure we're not, potentiating chronic disease problems we're encountering based on taking a medication over X number of years. The other piece that I wanted to touch on real quickly is, when talking to ASCP and Chad in particular, he was talking about going and working with US Aging, which makes a ton of sense. The society of like consultant pharmacists, or at one time senior care pharmacists, was a consideration, right? So aging makes sense. The thing that didn't make sense was them working with US Boxing to me initially, right? It was just like, how do you connect the dots there? And maybe that's exactly what we need, Jaron.
Yeah.
As you mentioned, we need other collaborating, provider groups and or healthcare team members to look at us as being not just the folks behind the counter, making sure the insurance works and we can push the pills across the counter. We have to be able to be looked at as this is an integral part of my workflow that I have to make sure they are there because they keep me safe, they keep my patients safe, and they have expertise I can't get from anywhere else. And to change that perspective or that mindset, is kind of one pharmacist at a time is the way that we've been going about it, right? One pharmacist, one facility at a time. Things don't scale that way. And so I think this US Boxing push by ASCP is genius. I think more of us need to get out into our communities to start saying, hey, I'm a pharmacist and here's my expertise. I have this pharmacology expertise that can help you and be a specialist inside of your care. And so I love the paradigm, shift that we're going through there with going, we need to be exposed to places that people don't think we're going to be, and be pharmacists that are like the sore thumbs sticking out, because that's going to make us more powerful, for everybody to see us in these new roles because they've never thought of us there before. Well, great. Now we're showing up.
Yeah. And, I want to see pharmacists become an expectation that patients have when they go to a physician clinic. Here's your, list of disease states. Okay, we're going to have you visit our pharmacist once every X amount of months to help manage this specific condition. Yes. I would like that to become a standard expectation, because there's a lot of value in that, and it extends the reach of the clinical care that we're offering these patients, especially with these chronic disease states. And, I think we also need to start educating people to get out of the frame of mind of more pills equals more value. And, because a lot of right now, we're going to have a growing population of obesity, a growing population of diabetes, metabolic disorders, heart problems. And so we need to not only educate people on the value of when the pills are appropriate for those problems, but also the value of non-pharmacological interventions that will be far more powerful than any pill they're going to take for those specific conditions. And, there's just not enough health practitioners or healthcare practitioners to go around.
Yep.
And the more we work this as a team, the more we're going to be able to get more education to the people who need it the most.
Yeah, and I think that's the last thing I want to touch on there, Jaron. When it comes to healthcare tomorrow, I envision the pharmacy technician and the what is called a CHW, or the community health worker, as being two of the most integral members of the team to be able to expand what we can do as individualized specialists. So I would love to be able to spend every waking moment talking to individual patients, walking them through every step they need to take within their care, but no one's going to pay me for that, Jaron, not at scale, right? And so we have to be able to leverage other members of the care team to take on some of those additional care elements, along with technology, to be able to scale us. I wanted to hear your thoughts on, how do we scale pharmacy, in a realistic manner?
And we're talking about how to utilize pharmacy techs in that process.
Yeah, I mean, scale us in terms of leveraging other care providers that can be part of our network, and scale us in terms of, how do we make sure that we're being impactful inside of the matrices. You told me at one time, you and I were talking a ways back about, here's the way that Medicare views us. If we move them into provider status or XYZ status, this is how many billions of dollars it will cost the system by adding them into that fray. And so I think that when it comes to scaling, we have to think of it as two-part. One, what role do we play and how do we get paid for it? And two, what roles do others play to support us so we can broaden our scope?
Yeah, absolutely. I utilize, there's not a lot of pharmacy consultants in nursing homes that utilize pharmacy technicians.
Okay.
I'm sure there's maybe one or two out there. I actually use them quite heavily. I will say that there's a law called the Impact Act, and that requires a medication review and reconciliation to occur within 48 hours of a transition of care from a hospital to a nursing home, or nursing home to assisted living, or et cetera. And it doesn't even have to be a pharmacist. So, a lot. It's kind of pathetic, but that being said, most of my facilities do want the pharmacist to do it, and I've proven to them that that's the way they should do it. And so they even when they want to cut costs, they still find value in that, and they're like, oh, we're going to keep that aspect, keep that going.
Nice.
But with that in mind, it's really difficult to crank out enough admission reviews to justify the cost of doing it. I was not able to do it for a long time because I was only cranking out maybe 6 per hour, 6 reviews, and that's not very good at all. It changed when I finally brought on a pharmacy tech who I hired to do just the reconciliation.
Perfect.
And she was and so when I do the reconciliation and the clinical check and the duplication check and yada yada, it just took way too much time. By utilizing a pharmacy tech, they were able to crank out about 10 to 12 reconciliations per hour. And that helped me to hit about 10, maybe sometimes 12 per hour as well. And that justified me paying someone else to assist with it, because now I'm cranking out twice as many as I would.
Awesome.
And it's way more profitable. So finding the areas that don't require our expertise, that don't require our assessment or clinical judgment, and utilizing pharmacy techs to streamline that process and make us more efficient and more valuable is a very crucial component that we need to find a better balance with. Right now, there's too many laws that require us to follow archaic processes that could easily be delegated to a pharmacy tech, transferring prescriptions, things like that. And just the day-to-day operations, there's a lot of things we could delegate that would free us up to actually look at medication regimens, not just the script we're filling right now.
Yeah.
And make a bigger impact on preventive medicine in general. And this would allow, people in the community pharmacy to do more services that would prove more value and, collect more data to show how to pay us to provide more of these services. And so I think utilizing pharmacy techs will help us gather better data on our impact.
Totally. Yeah, I think you hit everything on the head right there, and a perfect example of leveraging a pharmacy technician to further your scope and overall view inside of a facility. Jaron, any other kind of leaving comments or information you want to be able to cover before we let everybody go for the evening?
Yes, I was reading a book. I forgot what it was called. It's about, setting goals and business goals and yada, yada.
Yeah.
Measure what matters. and I'm going to paraphrase the quote. I don't remember exactly, but I think this is something I think we need for pharmacists in general right now. There was somebody on the Google team who, when he hired people, or when a quote he would frequently say to people is that we need people with a healthy disregard for the impossible. And right now, we need a lot of pharmacists who have that same healthy disregard, because if you take a disregard for the impossible too far, it's toxic and problematic. But if you have a healthy disregard and you question, well, that's not impossible, we can make an impact here. We need a lot more pharmacists to take that assertive and proactive approach, to have that healthy disregard for what's impossible and start proving what we can possibly do. So
love that. Inspiring note to be able to leave on. Hopefully everybody enjoyed the show. Thank you so much for being able to join, all you folks that I'm seeing on here that are here with us. Any other comments or any information you want to give Jaron and I? If you want to jump on the show with us sometime, let us know. We'll be back again next week, and we'll be covering a really interesting piece that Jaron and I are talking about, creating roles inside of the pharmacy world to be able to do exactly what we just talked about. How do we create roles and create the education to make this a reality, this pharmacy of tomorrow? So excited to have you guys there. And if anything else pops up, you guys let us know. Join our PH Ally and hopefully follow this show. And we'll be talking to you soon.
Thanks a lot.
Good night.